Next, we're going to briefly talk about the respiratory function and sedative hypnotics. So, what is the mechanism of respiratory compromise? Adverse effect on respiratory drive are directly as a result of sedative hypnotics or opioids, and indirectly as a consequence of brainstem hyperperfusion that can result from hypotension if it's not detected early on. There may also be a marked increase in the work of breathing because of the increased upper airway resistance. Protective airway reflexes may be attenuated from the sedative hypnotics. During normal inspiration, the pressure within the upper airway is subatmospheric. There is a tendency for the upper airway to collapse under the influence of the surrounding pressure, and this tendency for airway collapse is opposed by upper airway dilator muscle tone. The upper airway dilator muscle control is extremely sensitive to sedation and with sedative hypnotics. And in the elderly, this is particularly exaggerated. Competent laryngeal and upper airway reflexes are required to protect the lower airway from aspiration, and is depressed by anesthetics and sedation, and is worse with advanced age and debilitation. The time required for the return of the protective reflexes varies, and complete recovery of the swallowing reflex occurs about 15 minutes after return of consciousness when you do propofol. IV administration of 15 mg of Valium depresses the swallowing reflex for up to 4 hours. The swallowing reflex is significantly depressed for up to 2 hours after midazolam, despite returning to a normal state of consciousness. And 50% nitrous markedly depresses the swallowing reflex. So even though the patient is still conscious, the swallowing reflex is gone. Sedative hypnotics depress respiratory drive. You all know this. During regional anesthesia, deafferentation potentiates this respiratory depressant effect of sedative hypnotics. Opioids depress the ventilatory response to hypercapnia and hypoxia. Benzos affect on carbon dioxide responsiveness is mixed, sometimes no effect, sometimes significant right shift. And when opioids and benzo are used in combination, we have consistently and markedly depression of respiratory responsiveness.